that for me. And then if you take your seat in the first chair there. Thank you.
Hi, I'm Dr. Sally Johnson. I'm a GP and the Surrey Vaccination Clinical Lead.
Hi, my name is Emily Woodward-Stammers. I'm a healthcare professional by background. I work across Surrey and part of my role is to support care homes. So colleagues have had a few concerns over how safe the Covid-19 vaccine is.
Okay, so I'd like to reassure you that the Covid vaccines used in the UK are all safe and effective. And they've all been through a large regulation process with the MHRA, that's the Medicines, Healthcare and Regulatory Advisory Committee. And they are there just to test and check that everything is completely safe before they approve it. I can understand that some people might think that we've got to this process quite quickly, but I can assure you, because there are trials going on across the world, worldwide, that all the data has been looked at. Furthermore, we've administered more than 5 million doses across the UK with no serious adverse effects.
Okay, brilliant. And how effective is the vaccine? I know there's been a few concerns around how effective it is.
So at the moment we're using two vaccines, the Pfizer vaccine and the AstraZeneca vaccine. And we know that they're extremely effective after you've had your 2 doses of the vaccine. We know that after your first dose, it gives you some protection, but you need to have full protection, you need to have your 2 doses. And I'd just like to remind yourself and your colleagues that when you've had your first dose, you will still need to use your social distancing measures, wearing your face mask, washing your hands, until you've had that second dose of vaccine when you have a much higher level of protection. I guess the other thing to mention here actually as well is that whilst we know it protects you from getting serious illness and of course from death, what we can't be sure of is whether it protects you from transmitting the virus, and that's why it's really important that we still protect the vulnerable out there. So even after your vaccine, you do still need to follow government guidelines, as I said, to hands, face and space.
Brilliant. And does that include us wearing PPE when we're doing face-to-face hands-on care?
Absolutely. So when you're working in your nursing homes and your care homes, you still need to wear all the PPE that you have been wearing to date, even if you've had your first dose of vaccine. And until the government changes that advice, we need to make sure that all of you and your colleagues continue to wear that PPE to protect those vulnerable people.
So there's been some concerns from colleagues around the vaccine and fertility. Could women struggle to get pregnant after having the vaccine?
I'm pleased you brought that up because I know that in social media there have been some scare stories about fertility. So the experts in this field, so that's the Royal College of Obstetricians and the midwives, are very clear that there is no clinical, credible way that this vaccine can affect your fertility. There's absolutely no evidence or data to suggest it can affect your chances of getting pregnant. So, and it's really important that the younger care workers do get vaccinated so that you can protect your elderly residents in care homes or other vulnerable people in the public. So, I can assure you that there's no evidence to suggest this vaccine affects fertility. And, you can carry on and plan your pregnancy straight after having the vaccine.
Okay. And if somebody's already pregnant, can they also have the vaccine?
Yeah, so we're not routinely vaccinating pregnant women yet because we haven't had enough trials on pregnant women yet. But there will be some pregnant women who are particularly high risk who we think it would benefit them to have the vaccine. So if you think you're high risk, either because you have other illnesses or maybe you work in a very high risk field, we're urging you to talk to your obstetrician and they'll be able to advise you whether you should have the vaccine or not. But at the moment, as I say, we're not routinely vaccinating pregnant women.
Okay, brilliant. And what about breastfeeding? Can women still breastfeed their babies?
Yeah, so we feel the benefits of breastfeeding are great, and actually the risks from the vaccine are tiny, if any at all. So whilst we don't have data for this particular vaccine on breastfeeding, we do have lots of other data on vaccines and breastfeeding, and the advice is that it's safe and effective and sensible to consider having the vaccine even when you're breastfeeding. It won't do any harm to your baby.
There's been some concerns around if you've had the vaccine and then you get pregnant, the baby may have birth defects. Could you tell us a little bit more about that?
Yeah, so I can reassure you that the vaccine is not linked to causing birth defects at all. I think the important thing to remember is that when you're pregnant, there are a small number of pregnant women who are actually at higher risk if they catch coronavirus, that they might be more seriously ill and that can have a prolonged hospitalisation. So I think the most important thing for high-risk women is to make sure they're protected from getting coronavirus. And for those women, the only way to protect them is to give them the vaccination. That is the best way to protect them. What we do know is that it's not a live vaccine, and none of the ingredients in the vaccine have ever caused problems in pregnancy or in the babies born to pregnant women. So I think the people in the regulatory authorities are very confident that it's unlikely to cause any problems in terms of birth defects. And if your obstetrician thinks you're high risk and actually it's worth you having the vaccine, then I'd strongly advise you to consider that and taking their advice.
So Sally, if I was to have the Covid-19 vaccine, what side effects might I get?
So most people seem to get an aching arm where you've had your vaccine, and that lasts maybe 2 or 3 days, and that's very common. And then a few other people will get other mild side effects. So that might be a bit of a headache, slightly aching muscles, feeling a bit tired, maybe even feeling a little bit sick or having a slight fever or temperature. So it's absolutely fine to take some paracetamol if you have those symptoms. That should reduce your symptoms. But if at any time you're worried, you can always call 111 and they can give you further advice.
So Sally, I know we've had some concerns as well from colleagues, different cultures around the ingredients in the vaccine, and are people likely to have a severe reaction?
Yeah, I can understand those concerns, and we've heard those concerns as well. But I can categorically state that neither of the vaccines contain any animal products or egg. What we're saying is with the Pfizer vaccine, and actually with both vaccines, if you've ever had a serious anaphylactic reaction to a vaccine before, then we're going to need to have a more detailed discussion with you, and it might be that you're not suitable for one or other of the vaccines. But this is a very small number of people. There's also a small number of people who have an anaphylactic, so a really serious allergic reaction to lots and lots of drugs. And again, those people, we'd want to have a detailed chat with them about whether they're suitable for this vaccine. But the vast majority of the population, even if you have food allergies or allergies to bee stings or to nuts, that's not a reason not to have the vaccine. The vaccine is very much safe in those patients. The only patients that can't have this vaccine are ones who've had serious allergic reactions to vaccines in the past or things that are in vaccines. Now, even that is quite confusing to know whether or not you react to things in a vaccine. So what we'd like you to do is, in the first instance, just speak to your GP and have a chat with them about it. From their records, they might be able to tell you what you've reacted to in the past. If they're in any doubt or unsure, they will advise you to attend your vaccination appointment, and there you'll be able to speak to a doctor or nurse who's very experienced in vaccinations. They'll be able to go through with you exactly whether or not you're eligible.